Hello beautiful people, good day and welcome to our video for today. In today's video we're going to be discussing extensively about tooth fracture. Yes, I'm going to tell you the definition of tooth fracture, the causes of tooth fracture, the types of tooth fracture and their remedy. Of course, if it can be studied, definitely there is a remedy. So I'll please love you to hold on and watch this video with me to the end. I'm sure you are going to be educated and enlightened. Now let's get into business. What is tooth fracture? Tooth fracture is when there is a crack or a break in the teeth, okay? When your teeth is cracked or broken or divided into two or more pieces, all right? Now, in most cases, these fractured teeth, the fractured part do fall apart and separate from the main teeth, whereas in some cases, the fractured part still remains together, especially if the teeth is fractured from the crown to the root. Okay, now all these are classified as tooth fractures. Okay, I'm going to tell you the causes and the remedies as well. What are the causes of tooth fracture? Okay, now primarily, first of all, the causes of tooth fracture could be trauma or injury. Okay, trauma or injury, I mean maybe you had an accident or maybe you were fighting and then somebody blew you on your face, or maybe a very hard object hits you on your teeth, or you fall on the floor as well. This could actually cause the teeth to fracture. Why? Because of the sudden force that hit your teeth. Okay, this is the first cause of tooth fracture, right? Now, the second cause of tooth fracture could be tooth grinding or bruxism, right? We call it bruxism when you are fond of grinding your teeth against each other. A lot of people have formed a habit out of it, and I've said this times without number in many of my videos that bruxism is not a good oral habit. If you are fond of it, please, I will advise that you desist from it as soon as possible, okay? Bruxism can actually lead to tooth fracture. When you are grinding your teeth against each other, you are weakening the strength of the teeth. And then at some point in time, a part of the teeth will actually fracture and cut itself off from the main teeth. And that is actually not what you want, I'm very sure. Yeah, the next cause of tooth fracture is when you are fond of biting or chewing on hard objects, okay? When you are fond of biting food that you know are very strong or very hard, or possibly you are fond of using your teeth as a tool to open bottles. Yeah, many of us are guilty of this actually, but it is very bad. Do not use your teeth as a tool. Do not use your teeth on hard objects. I've also said this in many of my videos. Do not use your teeth on hard objects. Why? Because these hard objects have the capacity to fracture your teeth and cause more damage to your teeth than you actually expect. Okay, so please get the right tool, get the right instrument for the job, and do not use your teeth. All right, the next cause of tooth fracture is tooth decay or caries, as we normally call it. Okay, when you have a carious teeth or when your teeth is decayed to an extent. I've made a video also on tooth decay. I'm going to put the link to that video in the description box for this video, so I'll please love you to check it out, and I'm sure you'll be educated. So when you have a decayed tooth, it can actually lead to tooth fracture. Why? Because the decayed tooth or the carious teeth is actually reduced in strength, right? The strength of the teeth is reduced. And then any force that just hits the teeth a little bit will actually cause the teeth to fracture or to divide. Why? Because it is not strong initially, okay? So please, as much as possible, take good care of your teeth, brush your teeth 2 times every day, and floss your teeth regularly in order to avoid tooth decay. Another cause of tooth fracture could be sudden temperature change. Okay, sudden temperature change. Maybe you are used to eating foods that are too cold or something, and then there is a sudden temperature change from hot to cold instantly. It can actually lead to tooth fracture. Okay, now aging can also lead to tooth fracture. Our older parents are actually prone and more exposed to tooth fracture than younger ones. Why? Because their teeth is old and weak and not as strong as that of younger ones. Okay, so aging can also lead to tooth fracture. Now, large fillings can also lead to tooth fracture. Okay, large fillings. Now, large fillings, I mean, maybe you have a tooth, you have a carious teeth, or you have a tooth decay, and then you go to the dental clinic, and then they fill up that part of the teeth for you. Okay, now if the fillings are too large for the cavity, it's actually going to cause tooth decay. If the person that did the tooth filling for you is not well experienced and not well trained in his job, it can actually lead to tooth fracture. Okay, so please, as much as possible, make sure you meet the right dental practitioner for your dental solutions. Otherwise, you're going to cause more harm to yourself than good. Okay, what are the types of these fractured teeth? Okay, now the types of these fractured teeth, first of all, we have what we call the crazed lines. Okay, crazed lines is the appearance of minute cracks, like very small cracks on the enamel of the teeth. The enamel is the outer covering of the teeth, the white part of the teeth you can see with your eyes. Okay, now we call them crazed lines because they are very minute and very small. Now next we have what we call the fractured cusp. Okay, cusp, C-U-S-P. Now these cusps are the chewing surface of the teeth, especially the posterior teeth, the teeth that are behind, talking about the premolars and the molars. So in some cases, you find out that the cusps are broken, are fractured, and they fall off, especially when you are using the teeth on hard food or using it as a tool. Okay, now this is what we call the fractured cusp. Now we also have what we call the split tooth, right? The split tooth is when the whole teeth is divided, like from the crown down to the root is broken, is divided into two. Okay, this is actually very painful and it's very rare actually, but it's very painful and it's caused by eating hard food and chewing and using your teeth as a tool. We also have the fractured teeth and we have the vertical tooth fracture. Okay, these are all types of tooth fracture. And then the classifications for tooth fracture are basically classified into three. Okay, tooth fractures are basically classified into three. First of all, we have classification based on location, classification based on the severity, and then classification based on direction. Okay, now next we are going to talk about the prevention for this tooth fracture. How do we prevent tooth fracture from occurring? This is where I come in because I love you all and I don't want any of you to have tooth fracture. Okay, now first of all, if you want to prevent tooth fracture, if you are a sports person, please make sure you use mouth guard during activities. Okay, we can see that in boxers and wrestlers and other athletes. Okay, if you are engaged in any sport that you know could potentially harm your face, you are advised to use a mouth guard. And then next on the list is that you have to avoid chewing on hard foods. Since in the courses we discussed that eating hard foods can cause tooth fracture, then it will be wise for you as a person to avoid eating hard food so that you don't get your teeth fractured. And then we also talked about using your teeth as a tool. Do not use your teeth as a tool if you want to avoid tooth fracture. If you don't want to fracture your teeth, do not use your teeth as a tool. Make sure you get the right tool for the right job, and it will actually save you a lot of stress, a lot of pain, and a lot of money in the long run. Okay, and then you have to avoid bruxism. You have to avoid grinding your teeth or clenching your teeth against each other. It is a very bad oral habit. And then almost the last now, you have to maintain good oral hygiene. Okay, you have to maintain good oral hygiene. You have to take very good care of your mouth, take very good care of your teeth so that you don't get tooth fractures. And then you have to avoid sudden temperature changes. All the things I mentioned as causes of tooth fracture, it will do you good to avoid them, because when you avoid them, you are definitely reducing the risk of having a tooth fracture. Okay, now perhaps you already have the fracture, perhaps your teeth is already fractured by now, and then you are wondering, what is the solution, what is the way out, is there any remedy for your fractured teeth? I'm here to tell you that yes, there is a remedy for your fractured teeth. Now, the first remedy for your fractured teeth is what we call tooth buildup. Okay, if a portion of your teeth is fractured and it has fallen off from your mouth, you can actually visit the dental clinic, and we are going to do what we call a tooth buildup. We are going to build up that part of your teeth to look exactly like the natural teeth as it was before. And in fact, by the time the job is done, except you tell somebody you once had a fractured teeth, nobody is going to know, because it is going to look natural and exactly as the natural teeth. Now, the second solution is you can also go for crowns and veneers to cover that part of your teeth that is fractured, so that it is not seen from outside, and so that it protects the entire teeth from further damage. Okay, now last but not the least, the last solution for a fractured teeth is tooth extraction. And then this is feasible when the teeth that is fractured is damaged beyond repairs. Okay, now it is actually going to cause you a lot of pain and discomfort if the teeth is fractured beyond repairs, if it is fractured from the crown to the root. Okay, so it will actually do you a lot of good to visit the dental clinic and have it extracted. When you have the teeth extracted, it is going to stop all of the pains, and then you will get a denture or get a replacement that will fill up that space. Okay, this is the last solution for tooth fracture. We actually don't want that, and that is why I'm making this video, to educate you so that you avoid tooth fracture as much as possible. From the look of things, it's like we've come to the end of this video. I would please love to see your comments in the comment section. If you have any questions to ask, and if you have anything you want to let me know, please do that in the comment section. And I would love you to please like, share, comment, and subscribe, so that you get notified when next we release educating and interesting videos such as this. My name is Joel Jethro, and I'm happy to have you. I would love to see you in my next video. Bye.